moving on to the live session straight away. It is my absolute pleasure to introduce today Jude Igumbor, Associate Professor at the School of Public Health at WITS. He is also the co-focal person for CARTA at that institution. Nothing else to say. Jude, the floor is yours when you're ready.
Thanks a lot, Martha. Can you all see my screen I'm sharing?
Yes, we can.
Okay. And thank you for the introduction, and thanks to all those who organized this 10th birthday celebration. CARTA is a consortium, it is all of us, and it feels good to be a guest at your own birthday party, so thank you for that. My presentation is slightly different, that it seeks to look at the collective contribution of CARTA fellows in terms of the work being done by different people. And listening to today's presentation already, it gives you an idea of the different work being done by the different individuals that you can almost think of, people doing similar work. This birthday celebration creates an opportunity for you to see what each other is doing. But it's not every day that the CARTA celebrates its birthday for people to get the opportunity to know what each other is doing. And as such, we're hoping that my presentation will give a bird's eye view of what CARTA fellows have contributed scientifically, and maybe set the stage for a platform or a system where we can easily check on each other, maybe work across to collaborate and support each other. I mean, listening to the presentation just now, I listened to Karani. Karani's work is very similar to what Kaneso is doing and complementary in many ways. Chimweme's diabetes work is similar to, or could be complementary to what Martha, it's also another CARTA fellow called Martha is also working on, that they could all collaborate and work with each other to strengthen each other's work, but also answer some of these questions in a more holistic and complementary way. So my presentation really is looking at CARTA Fellows' scientific contribution to African population and health research agenda. We all agree that there's a strong need for research capacity in academic institutions to solve Africa's health problems. That resolution of some of these problems would need scientific, evidence-driven solution tested in a low-risk environment and known to work and practical for different contexts for it to be implemented, given our limited resources. In other words, putting our our limited resources into things that make a difference through the kind of scientific work that you're all doing. We know that research costs a lot of money, and the past inadequate investments in capacity to conduct research in Africa is changing. CARTA and the Deltas program is one of them, and many other networks we see across the continent that are coming up almost on a fast pace. These various networks seem to be advancing research, ability to conduct research in Africa. And a lot of these networks and investments are engineered towards creating an academy of African researchers who can publish and lead locally relevant research to make an impact on health and science policy and practice. And as CARTA would have it, it seeks to create a critical mass of research-oriented change agents across the continent. In doing this, we did an assessment of the contributions of the CARTA Fellows to African population and health research agenda. This was done through a basic bibliometric and contents assessment of their research outputs from between 2011 and 2018. We compared the publications against the research priorities identified by the World Bank, the Sustainable Development Goal, and the African Development Bank. And some of these priorities are listed here, including infectious diseases, which is a whole basket of conditions. or infections, non-communicable diseases, sexual and reproductive health, maternal and child health, health systems and policy, violence and injury, and mental health and substance abuse, and environmental health. Most of these topics, we've already seen and heard people present already today. And in terms of our findings, as at the end of 2018, the number of publications by CARTA fellows was sitting at 806. Remember, these are publications submitted to the secretariat that we reviewed. In other words, there could be more that are not included here. Actually, I believe that there are more, and I encourage fellows to ensure that your work is submitted to the secretariat, acknowledged, and counted as part of CARTA's contribution. As at the same time, the unique number of fellows who published this number of work were 140 fellows, and these 806 publications have been cited about 5,500 times, and the average, the median impact factor of the journals was sitting at 2.1. We know that we have a few, who are actually outliers, falling as high as 60 with your Lancet and many others. And in terms of the position of the fellows, so the fellows were not just passengers in this publication. 1% of the publications had fellows as first authors, and the average number of authors in these publications were about 5 authors per publication, a standard deviation of about 4. And in terms of the online versions that these 806 publications are in, is over 6,000. So these 806 publications are available in as many as these 6,300 versions online. Then if you look closely, you would see that the number of publications by fellows actually grew from the first year when they had about 20 fellows recruited in cohort 1 in 2011. And the number of publications that year constituted about 1% of all publications, that is the 806. And the number increased as the number of fellows also increased. And also in terms of capacity to publish more also increased over time, showing that indeed that CARTA is contributing to creating capacity for its fellows to publish scientific work. In terms of methodology used, predominantly a lot of the work publications are quantitative, followed by qualitative at 12%. We have literature reviews at 10%, and 6% were mixed method papers. Then distribution of the papers by the African priorities I already spoke about. Most of the publications were on infectious diseases, followed by health systems and policy. Health systems and policy here predominantly looked at your health system strengthening issues, potentially related to a lot of funding and support on health system strengthening in TB, HIV across the continent. We see also that gets followed by maternal and child health, sexual reproductive health, non-communicable diseases, environmental health, violence and injury, and at the bottom there you have food security and nutrition. I'm glad to see that a couple of presentations today are on nutrition. Hoping that begins to change as well. Specific to infectious diseases, predominantly a lot of it was on HIV, malaria, tuberculosis, STIs, and some were co-infections of either malaria, HIV, TB, HIV, and neglected tropical diseases. Then on issues around maternal and child health, most of the publications were on maternal and child mortality, use of antenatal care health services, other MCH topics, including things such as social cultural issues that impact on maternal and child health services, behaviors and attitudes as well. Some of the studies looked at immunization, early childhood development, obstetric and gynecological complications, and childhood illnesses. What was also notable is that the volume of research across partner institutions remains uneven. Some universities were publishing way more than others. Notwithstanding the increase in number of NCDs, and as we all know, or is being projected, that come 2030, NCDs in Africa will surpass infectious diseases. The recorded number of NCDs remains subdued compared to the number of TB, HIV studies we've seen. Of course, we're still grappling with TB and HIV, but indeed, non-communicable disease is really looming in Africa based on projections, and indeed something to start looking at quite closely. Considering a high volume of neglected tropical diseases, we also had a few of such studies. And despite the correlation between mental health, substance abuse, and but there were none of such studies among children and adolescents. And I'm glad to hear now that Catherine is taking up that kind of work, and as such, we begin to see more of that kind of research coming out of the CARTA group. So in our conclusion, our findings reveal that reveal the success of CARTA in building capacity for research in priority public and population health issues. CARTAs are contributing to improve African research outputs. If you look at the number of publications, the last time we checked a couple of months ago, this year, we had counted close to over 340 or more publications by all the fellows, and also the number of fellows publishing have also increased. So all that credit to the kind of support that fellows are getting from the CARTA Fellowship. This kind of research, given the fact that a lot of them speak to real contextual and practical challenges we see in the continent, a lot of it would contribute to informing policies, to addressing some of these issues that we face. And if we go back the vision, I started with in the first page, and the investment in CARTA, we're hoping that the combination of the work that we are seeing coming out of the program is definitely advancing the vision of the CARTA program. So as part of our recommendation, partner institutions with low research output need to keep developing capacity of its research ecosystem, consisting of the researchers, governance within the institutions, other units that support research within its ecosystem, funding environment that it exists in, and government involvement, private sector involvement to ensure that we're able to boost more research. And indeed, one could also say that the bias we've seen there is that the more PhD students you have, almost collinearity, the more publications we're seeing. So in other words, there's value in investing in PhD fellows to create more of these publications. So we also recommend an increased advocacy and lobbying of African governments to honor their commitments to research and higher education training as a part of true self-reliance. About a decade ago, a commitment was made to say that every African country would commit about 1% of its GDP to research and development and higher education. Less than 10 countries have been able to achieve that almost 10 or 15 years later. So more lobbying and advocacy still needs to go into that area. Capacity building activities should also include skills for knowledge translation, so that we don't end our research with our p-values and our levels of significance and our contextual framework, but also meaningful, tangible policy recommendations and practical solutions for communities to take up and use to make a difference in a language that they understand as part of knowledge translation. We're also recommending routine audits of the scope of research topics pursued by scientists to ensure that neglected topics of developmental significance are also being explored. So in terms of next steps, we as CARTA are adopting novel evidence management tools to begin to look in more detail at the kind of work that is coming out of CARTA. That in my earlier presentation, most of the priorities I listed were almost in silos, but in reality, a number of these issues do not exist in silos, and unfortunately almost exist in vicious circles that they perpetuate each other, that you almost need a comprehensive approach to dealing with issues. And in responding to that, no one individual researcher can do that. But as a consortium, if we look at our combined contribution, we may be able to make a difference by looking at the work that is coming out of the consortium. Although this is not the most legible slide, but if you look closely, you see that the biggest circle there really is really about children, and most of the studies are about children. It's about treatments, HIV, mortality, health, in this case, I think health system. And because we've gone beyond relying on the publications submitted by CARTA fellows, this analysis was done with data based on an online search that we have done for all CARTA fellows and also quality checked. We've seen that actually there are more studies on mental health in adolescents among fellows that are coming up, and other areas that we did not know that CARTA fellows are working in. And we are also able to now, even within these big bubbles in this top left diagram, that within them we begin to see thematic areas that fall under each of those big bubbles, and be able now to almost get into more depth analysis of the combined work that you are all doing as CARTA fellows, and that we would not say that there's malaria research among children, or rather, if we were to say what kind of research has been done among children, if we clicked on the children box there, you see that you see that we can point out that probably be able to isolate the studies around malaria among children, TB among children, and health access among children, mortality among children, and either put them together as a thematic area to present or discuss, or look at how they overlap. If you look down in the middle box, you see some of the kind of core issues or core themes that fall under the research area among children, which are very similar to what we have seen earlier in the box above and in most of the presentations. There are a lot of them about mortality, birth, vaccination, immunization, etc. And the box here, which is not visible at all, please bear with me. My knowledge of it, I'll try to interpret it. What you see, the different colors represent different clusters of individuals working on very similar topics. And the bigger the bubble, the bigger probably the individual who is working on that given topic. And it also shows co-citation between CARTA fellows, that you may be working in separate countries, thinking you're working in isolation, but somehow most of your work is referencing the work being done by other CARTA fellows. And if we look in depth into that, we begin to see some kind of linkages between them, or some kind of latent association, that unobserved association between the different work being done by different CARTA fellows. For instance, the red here you see is Nicole de Vet, who I know works on adolescent health issues. She looks at adolescent health issues, looks at household welfare and condom use, household wealth, etc. Then if you look just below, we've just heard Maurice talk about early childhood development issues, nutrition, school attendance. That kind of research is what you see coming out of Maurice. And beneath them also, you also see Fagbemi working on things such as family planning, birth control, that at the end of the day, they may be separate CARTA fellows, but you almost see a continuum of knowledge from birth to our inevitable end, in terms of CARTA Fellows contributing to science from end to end. And the same can be said in terms of the different bubbles if we look at them in more detail, and also be able to create a comprehensive knowledge to address complex issues and complex questions in the African continent. So we may be working separately as individuals, but collectively, we actually working towards addressing collective and complex challenges that we face as a continent. I know I'm running out of time, so this is my last slide. As next steps, we are developing capacity to become more nimble and systematic, also accurate in in-depth review of thousands of publications emerging from the CARTA network, including related studies coming out of the continent. The presentation I made earlier was done very manually. We had about 7 individuals sit down in a room for over a month or 2 or even 3 months, going through all 806 papers to categorize them, catalog them, and present what we saw earlier. But with the adoption of tools such as natural language processing, semantic analysis, and other methodologies that we're now using, we're able to do this in a more efficient and more accurate and a more systematic way that is run whatever test in terms of what we say our contribution is. We're also considering efficient ways to generate routine plain language summaries of thematic or multidisciplinary evidence, like I said, to address simple to complex policy and practice knowledge gaps that we have in the continent. And we aim to increase the visibility of publications and uptake of evidence coming out of the network through knowledge sharing on an open source platform that will target key stakeholders such as your policymakers, program managers, program planners, frontline health workers, your street level bureaucrats, to inform their street level decisions, so that it's based on evidence and not based on exigencies. And down also to civic groups to also be able to take up the evidence, understand and take up the evidence coming out of the CARTA network because of the language that is presented in. So you think of such a platform as a crux between Wikipedia and the Conversation Africa, that it is well indexed, it is peer reviewed, it is regularly updated, it is in plain language, almost foolproof, for lack of a better word, for anybody to understand. And that CARTA fellows can think of developing based on the level of evidence that you are all generating. In my last count, based on Web of Science, the number of publications that I think are from CARTA fellows, knowing that we are undercounting, are over 2,000. And that still we need to verify, but I have more confidence that we are underreporting. And I believe that by the time we take all this together, we would be able to answer key questions, either in selected areas or group of areas or cross-cutting areas to address some of these issues. So I'm challenging CARTA fellows to join hands in creating this CARTA-led platform for progressive advocacy, capacity building, and health for all. I see Marta has put on a video. I guess it's my cue to stop. Thank you for the opportunity to talk.